A patient has a 49-year history of hypertension. Which part of the heart would be most enlarged on echocardiogram? A. Right atrium. B. Left atrium. C. Left ventricle. D. Right ventricle. E. Pulmonary artery. The answer is C. Left ventricle. The left ventricle is the most commonly enlarged heart structure seen in chronic hypertension. The left ventricle must overcome the afterload of the arterial system by becoming hypertrophied. As a result, the heart gets remodeled to overcome the systemic high blood pressures. The left ventricle directly pumps blood from the heart to the systemic circuit.
What organ of the lymphatic system is the site of T-cell maturation? A. The thymus. B. The spleen. C. The cisterna chyli. D. The lymph nodes. The answer is A. The thymus. T-cell maturation occurs in the thymus, a small organ located in the upper part of the mediastinum, between the heart and the sternum. Mature T cells then may either circulate in the lymph or blood or reside in lymph nodes. The spleen is not a site of T cell maturation, though it does have other important immune functions, such as the production of antibodies and the removal of antibody-coated pathogens. The cisterna chyli is a part of the lymphatic system that is involved in lipodigestion. Digestive fat is absorbed through what specialized lymphatic vessels of the small intestine? A. Villi. B. The cisterna chyli. C. Lacteals. D. Microvilli. The answer is C. Lacteals. Dietary fat is absorbed via lacteals, small lymph vessels contained within the body of the intestinal villi. Microvilli, tiny projections covering the surface of the villi, help with the absorption of minerals, vitamins, and other micronutrients. The cisterna chyli is a dilated pouch at the lower end of the thoracic duct that serves as a collection point for fatty chyle from the intestinal lacteals. Which of the following is not a function of the lymphatic system? A. Absorption and transportation of dietary fats. B. Lymphocyte transport and activation. C. Secondary gas exchange. D. Draining of interstitial fluid from tissues. The answer is C. Secondary gas exchange. The lymphatic system has several roles in the body, including drainage of interstitial fluid from tissues, transportation and activation of lymphocytes, and absorption and transportation of dietary fats. Red blood cells, however, are unable to enter lymph vessels, and so the lymphatic system does not participate in any type of gas exchange. When drawing blood, the client tells the nurse that she is a universal recipient. The nurse knows this to mean that the patient has which type of blood? A. O negative. B. AB negative. C. A positive. D. AB positive. The answer is D. AB positive. AB positive is a universal recipient, meaning a patient with AB positive type blood can receive a blood transfusion using any type of blood.